video to help you better distinguish whether or not you're looking at a right or left bone. So it's going to be really important that you're familiar with the landmarks, anterior views, posterior views, medial and lateral sides. Okay, so when taking your lab exam, it's going to be really important to be able to visualize the whole skeleton, especially when you're trying to determine whether or not you're looking at a right or left long bone. Okay, I'm going to go ahead and begin with the femur bone. So it's going to be really important to determine your medial and lateral sides. I like to begin with the femoral head because it's always medial. This is a portion of this bone that articulates with the rest of the body. And then we need to identify if this is an anterior or posterior view. That this is the posterior view because of the intercondylar fossa. So if this is posterior and this is an anterior view, is this a right or left femur bone? Now imagine how it's attaching to the skeleton. This is a right femur bone. So if you're imagining it attached to a whole skeleton, you can see the bone we just identified is the right because we are always referring to our patient's bones. So now we have our tibia bone. The tibia has the medial malleolus, and since this is medial, I can identify the view as anterior because of the tibial tuberosity, and because of that, I can determine that this is a right tibia. As you can see on the skeleton, the bone we just identified is the right. We have our fibula bone. So the fibula has the lateral malleolus, and I look at the lateral malleolus and I look at how it would be connected to the tibia. So I know that because of this notch right here, that's how it articulates with the tibia. So since this is lateral, this is also going to be a right fibula bone. So now when I look at the whole skeleton, I can see that the fibula is a right. Because of this notch, it articulates with the tibia, and because of the lateral malleolus. All right, now we're looking at our humerus. The head of the humerus is always medial, so I know it's going to attach the rest of the body this way. Now we need to identify if this is a posterior or anterior view. I know that this is an anterior view because the ulna and fossa, which is right here, is pretty deep, so this is going to be a posterior view. Now that this is anterior and this side is medial, is this a right or left humerus? This is a left humerus. When you see the bone attached to the skeleton, you can identify that as the left humerus because, again, we're referring to the patient's bones. And this is also beneficial when you're trying to identify landmarks on the humerus because you have the medial and lateral epicondyles. So if you're trying to distinguish if this is what structure this is, always know that the head is medial and this is the medial epicondyle. Now we have the ulna. How do we determine if this is a right or left ulna? Well, first of all, we're looking at the anterior view. This should be, you should really understand that this is an anterior view, and this is posterior because this is our elbow. So we're looking at an anterior view of the ulna. Now, is it right or left? Well, when you're referring to these bones, they're always going to be in the referring to the anatomical position. And in the anatomical position, the ulna is always towards the pinky, which is medial. And this radial notch right here, if you can identify that, the radius goes here and the radius is lateral. Just like this. So, is this a right or left ulna? So this is going to be a right ulna. So if you're looking at the skeleton here, you can see how it's articulating and it's in the anatomical position. The ulna is always on the pinky side and the radius is always on the thumb side. So this is going to be a right ulna. Okay. With the radius, it's always on the thumb side, which is always lateral. So if we know this is on the lateral side, and this is an anterior view, and I can tell because of this smooth flat surface right here, it's always anterior. So because of that, is this a right or left radius? This is a left radius. If you're looking at the whole skeleton, you can see how we just identified that as a left radius. So during your study time, it's going to be really important to pay attention to the bones and their landmarks and their directions. If you have any questions, please leave them below in the comments. Thanks!